Now we are moving to the next question. You will be asked about the diagnosis. How can you diagnose pseudomembranous colitis? And here there are two parts. There is a gold standard investigation, okay, and there are general measures for diagnosis, okay. So if you are asked what is the gold standard for the diagnosis, so the gold standard for the diagnosis of pseudomembranous colitis is stool culture assay, okay. So what do you find in stool culture assay? You will get the toxins, okay. We will find the toxins, as we mentioned before. They are toxin A. These are produced by Clostridium difficile, and toxin B. And you may be asked at this point which is more potent. This one is more potent because it is a cytotoxic, while this one is less potent because it is enterotoxin. Okay. Well, so let us get back to the diagnosis in general. So in the investigations, you will start naturally, as usual. You will start with full blood count, and here you will find that you have very high WBCs, okay. And you will do your chemistry, okay. And in the chemistry, there will be albuminemia, okay. So in the chemistry, there will be low albumin or hypoalbuminemia, and you can do PCR, okay. You can do ELISA also, fine. This is the first set of investigations. The second set of investigations that is very important is you are going to do either rapid flexible sigmoidoscopy, okay, or you are going to do a colonoscopy, okay. These are the two endoscopic investigations you are going to do, fine. And as we mentioned before, the gold standard is the stool culture assay to detect the A and B toxins. Well, you may be asked, what will you find in for example, this rapid flexible sigmoidoscopy? They may ask you, okay. And in this case here, you have to mention that in rapid flexible sigmoidoscopy, okay, you will find yellow plaques, okay. Yellow plaques are a sign of the pseudomembrane, okay. And you will find some exudate, fine. You are going also to find fibrin, and absolutely you are going to find some necrotic tissue, okay. So these are the findings that you will find in rapid flexible sigmoidoscopy, and in colonoscopy it is the same also, okay. This is the second set of investigations, as we mentioned. Now the third set is the CT, and they will ask you what are your findings in CT scan. So you have 6 findings that you have to know well. And number one, you will find thickening, substantial wall thickening. It will be mostly more than 3 centimeters. Okay, number one, there will be thickening. Okay, more than 3 centimeters. Number two, you are going to find edema on the CT scan. Number three, you are going to find something called hyperattenuation. Hyperattenuation, okay. And hyperattenuation here means that you will find there is an acute inflammation there. It's a sign of acute inflammation, okay, for this one. And you will find a sign called, and it is a very important sign, a sign called thumb printing. Thumb printing. Okay, something like a finger that is coming from a hand like this, okay, something like that you will see in the CT scan. And finally, you will find the sign. This sign is called aura contrast, and aura contrast actually, or contrast aura, this is a sign of edema. Okay, so in the CT scan, there will be thickening more than 3 centimeters. There will be edema associated with contrast aura or aura contrast, and you will find hyperattenuation due to acute inflammation, and you will find the thumb printing sign. Okay, so in general, these are the measures by which you can diagnose pseudomembranous colitis.